Good evening. My name is Linda Kamate. I'm the Director of Public Relations and Marketing at Newark Beth Israel Medical Center. And I'd like to thank all of my physicians who are here today from across the RWJBarnabas Health system who've joined us for this webinar, COVID-19 Vaccine Fears, Hesitation, and Access, What the Black Community Needs to Know. I'd like to begin with a brief introduction of everyone that we have here with us today. Dr. Marilyn MacArthur, the Medical Director of Obstetrics and Gynecology at St. Barnabas Medical Center. Dr. Arnold Williams, psychiatrist at Barnabas Health Behavioral Health Center. Dr. Stephen Ford,
it says audio pen 3.
internal medicine at RWJ University Hospital Rahway. Dr. Schubert Parat, the chairman of emergency medicine at Jersey City Medical Center. And Dr. Omar Bey, critical care and pulmonary medicine at North Israel Medical Center. And Dr. Donald Beggs, infectious disease at Clara Maass Medical Center. So thank you all for joining us today. According to the Centers for Disease Control and Prevention, we know that just over half of the people who have received the vaccine to date have reported race and ethnicity. And of those who have reported, there are about 2/3, 65%, who reported as white Americans, and only 7% were Black or considered African American who reported. So that is a huge gap in numbers, 65% white, 7% Black. And so that's why we're hosting this webinar today, to dig into that a little deeper and talk specifically about the hesitancy and some of the fears and some of the access issues that African Americans, that people of color, Black people are facing today in trying to get the vaccine. So I wanted to jump right in and throw this question out to everyone about why do you think there is such a huge gap in vaccination rates between white Americans and Black Americans in general? I'll just open that up to everyone here.
I think a large part of the problem stems from 3 things: trust, fear, and access. All of us are, and a lot of reviewers are pretty knowledgeable about the institutional exploitation during the 50s, the Henrietta Lacks experiments, the Tuskegee experiments in Alabama, and even up to modern day healthcare disparities that we know about and have seen during our time. These things create a very hot ember, which then leads to the flame of fear. And I think that the fear then is the fear of being experimented upon, the fear of political and social necessities for getting the vaccine, and also people mentioning that they want to wait until other people get the vaccine. The third leg, of course, is the access issue. Even people who want to get the vaccine are having difficulties, not only in our community but other communities. They're having difficulties accessing the system itself. And then if you add to that elderly Americans and people who are not really internet savvy, it presents a problem that almost becomes insurmountable. And then added to that mountain of insecurity comes the pharmacy deserts. There are some communities that don't have pharmacies in their particular area.
Yeah, I mean, and piggybacking on that, I think there are other aspects as well. I mean, the Black community for so many years have been, treated with, well, you could say without respect and honesty. And honesty is a key component. And there are many levels of disparity in our community, many levels. I mean, just think about it, healthcare, education, the opportunities for jobs and pay, or where you live, or whether even there's a grocery store near you so that you can eat food that's healthy for you. All of these things on a day-to-day basis, the Black and brown community have to deal with. So disparity is in the past, it's in the present, as well as the future. I mean, the culture, this is a culture that has survival instincts, I should say, over the generations. We've developed these survival instincts. And at this particular point, we have to understand that the numbers don't lie. When you look at 7% of African Americans going to get the vaccine, and over 40% or 46% of Caucasians, this is true. This mistrust is here and ongoing. And understand, trust must be earned. So all I can say is that the message that we give that this virus is deadly, that's true. But the vaccine, that message also has to be honest, it has to be consistent, and it has to be in a way and put forth such that people can truly understand that you're talking to them and that you have their best interests in heart. So I just think the mistrust is there. We have to let people know that the message is honest. It's coming from our hearts, and what we're saying is true.
I mean, I agree. There are concerns about historical wrongs and conspiracy theories about pharmaceuticals and the government doing this and the government doing that. But I think in the main, people are concerned about safety too. And they want to know if they put a substance in their arm, you ask them to put a substance in their arm, they want to know that it's not only is effective, but it's safe. And they also want to know how come you say the vaccine takes 10 years to develop, and this is just a few months and you already have a vaccine. I mean, these are bona fide questions. They want to know how come the mechanism that you're using is a new mechanism, and does this going to stay in my system? Does it going to interact with my DNA? Is it going to give me concerns down the road? So I think as health professionals, we have to address these issues and let them know that they can have the confidence in the safety and the mechanism of action of the vaccine. I mean, notwithstanding some of the historical wrongs, I think the fundamentals here are different this time. Everybody's getting the same vaccine. And there was a lot of diversity in developing the vaccine as well as in the trials. So I think there are a lot of issues here, as everybody pointed out. And access is another issue, as Dr. Ford said. I mean, you got to concentrate the vaccines in the zip codes that are mostly effective. You got to make the sign-on process less cumbersome. So these are some of the things that we should have discussed and addressed.
I believe we have Ms. Yates with us. Tony, are you on the line? Tony Yates, are you on the line? I thought she might be with us. No.
No.
Okay, well, I do want to address, because you brought up many points about access and about questions that people have about safety. Perhaps you can talk more about what are the specific questions that patients ask and how do you address their concerns? I want to throw that first to you, Dr. Ford, and then to Dr. Bay.
Sure. The question I think I encounter the most is, what should I do? Should I get this vaccine? I think that we owe it to the American public. We owe it to our patients as well, to be totally transparent with them, to be open with them about the facts, and to let them know that anything important that they do in life is usually measured by a risk-benefit ratio. If I'm looking at a problem, I have to ask myself, is the benefit of getting the vaccine worse than getting the vaccine itself? I mean, getting the COVID-19 virus itself? And when you weigh it in that way, and then you mention the facts to them, the facts being that African Americans are 3 times more likely to become infected by COVID-19 than the general population. We are 4 times as likely to be hospitalized, and we are 3 times as likely to die from COVID-19. Anyone who is measuring this will look at it and make the correct choice. And add to that, one other thing, add to that, we have the top 4 diseases for our community happen to be hypertension, diabetes, cardiovascular disease, and obesity. And that increases the likelihood that you're going to catch this virus.
Dr. Bay, so thank you, Dr. Ford. I mean, a lot of we see that 3 times as likely to die, you know, much greater rate of hospitalization, all of these comorbidities. Dr. Bay, why do you think this hesitancy still exists, even with these numbers and people seeing it in their own communities, right? Friends, family members, colleagues?
Yeah. You know, the thing of it is I look at it from my point of view as talking to my patients. And I think the hesitancy is there because of, as I stated before, mistrust to a certain degree. I mean, throughout the ages, there's been this mistrust. So what do? I think truly as physicians, as people in our community that are trusted clergy, we have to listen to people. We have to truly listen to what they say. And their fears and mistrust is real, and we have to understand that it's real. Telling them that, oh, it's important to take the vaccine and maybe life-saving, okay, that's all well and good. But as a physician, me talking to my patient, the physician could be wrong. He doesn't. It's understood that about 80% of patients do respect their physicians and respect their opinions if that physician is the same race and color of that particular patient. Now, getting past the life history of mistrust is really important. And that's what we as people who are talking about healthcare, talking about, you know, being healthy and what medicines you should take and that you should take this vaccine, that's the most important thing, that trust. You know, racism, and we have to call a spade a spade. Racism is woven into all aspects of this society. But understand that we have to be compassionate and listen to the reasons why someone would be hesitant in taking this vaccine. You know, someone had told me a long time ago that truth without compassion is brutality. You understand? So we have to sit back, we have to break it down, we have to at their level and give them an understanding why it's so important. As Dr. Ford said, we're so much more likely to die from this disease, but we're only 7% of the people taking the vaccine. So we as physicians should really come down to a level and come off our high horses and come down to the level and really talk to our patients from a compassionate, from a way that is directly, you know, to them, such that they will listen and they will take it as a heartfelt, you know, that we really feel that this vaccine is safe, that it saves lives, and we are the target. We're the number one target for this disease, and we're the ones who are dying.
Thank you, Dr. Bay. Dr. Parat, you've been going and talking to employees all over at Jersey City Medical Center. I know you talked about having to dispel a lot of myths. What are some of the myths that you've heard? I mean, you're out there listening to many employees there. What are you hearing?
And it's been a very interesting journey. I think just to add to what's already been said, there's social media out there. Social media has really changed. That's something very different that we've never encountered, especially with this disease. And we talk about the disease a lot when we talk about the vaccination. And the social media aspect of it just leads the general population to really want to believe what they hear on social media as being the truth. It's on social media, so that's got to be the truth. There has to be some truth in it. And even though the truth may be 1%, but it's what's highlighted, it's what everybody hears, and it just causes fear. You know, so we talk about people, you know, in these sessions would say, well, am I going to grow a new appendage? Am I going to have a third leg? And you're like, if you didn't have a third leg before, you're definitely not going to get a third leg now. You know, that's not the way the vaccine works. And, you know, people want to know in general, is it safe? And, you know, we have to tell them that there are many other vaccines that you or your family may have taken that you don't know what has been in those vaccines. And you've never researched what's in those vaccines. You've just accepted them, and you knew that whoever was giving it to you did so in your best interest. And I think that's also another piece that people have to understand, that from the opposite side, like, we're doing this for your best interest. And, you know, folks will always say, this vaccine was developed way too fast. I'm going to wait till next year. But for some of us, there may not be a next year. And that's what I try to emphasize. You're taking a serious risk. And, part of my job and part of my responsibility is to tell them about the reality of what's going on. The reality is that, we are the people who are suffering the most from this. We are the ones in close proximity to one another. We are the ones who succumb to this disease and have very poor outcomes. So, and people don't know those realities until they're actually spoken, because they just think that they rely on what they hear on social media, what they may hear from their friends. They're not actually hearing it directly from medical professionals who we do our own investigation. And then we have to tell them, as we're setting ourselves up as the example. Yes, I understand that the vaccine was made quickly, but it was made quickly for a reason. Right. And we've never been in this place before. So it really calls for different ways of going about the normal, everyday things. And, the truth and honest, I just have to be honest with folks and say, hey, listen, you may have heard about other therapies that potentially work, but those therapies have all been proven to be, okay. They're not the greatest thing. It's not like everyone should be using this now. But the vaccine universally is accepted by most clinicians as this is what you should be getting right now to protect yourself. So really making it sort of clear and obvious, and people thinking it's going to change your DNA. Like, well, you got other vaccines that are used the same method to actually get the vaccine to work and activate in your body. So, so you've been exposed to it before. It's just a very smart delivery system that, that this is the way that the vaccine's created. And this is the way it's most effective, and this is the way it's going to be most helpful. So, so the rumors keep coming back and forth. Go ahead, Dr. Ford, you were going to add something?
I'm just going to say that, I've heard concerns about the vaccine being created very quickly, but think about it. The technology has gotten much, much better over a shorter amount of time. If you're talking about the measles vaccine or the mumps vaccine, they didn't have the technology that we have now. So just like computer chips downsizing, getting smaller and smaller, your cell phone. I remember when a cell phone was the size of a suitcase almost. And now you can fit it in your chest pocket. So as the technology gets better, the resources available become cleaner, we do it faster, and we get better results.
Yeah. And I also think, just along those same lines, it's about explaining. It's like everything that comes out goes through these very separate phases. And the phases stop if it's not effective or it's doing real harm to people. So it doesn't cross the next phase until it's known to be doing something good. And I think people need to hear that and understand that before they sort of pass the judgment that, this is not going to work because I know they pushed this through and they're just experimenting on me as well as everyone else.
Just to address the issue, yes, I agree with most of what everyone's had to say about social media. Misinformation is a big part of it. It's part of our job, and what we're doing tonight is to give information. For me as a physician, I know I had some hesitancy before the vaccines came out about whether I would wait to see. And the thing that changed it for me was having the right information. When they started talking about making vaccines at warp speed, I don't know, it must have been a Star Trek fan, but warp speed sounds super fast. And I think that was the wrong word to use because right away everybody assumed it was rushed. This technology is not new. The basic stuff has been around for 10 years and it's been used in chemotherapy. They're targeted. All they needed to do was get the right genetic composition of the virus and then attach it to this technology that's been around for 10 years, so not new. Once I heard that, I was like, ooh, not so new. The second part is how it actually is delivered when we started with the messenger RNA. Messenger RNA, if everybody thinks back to biology in the cells, you have your cell structure and you have your nucleus. Our DNA is in the nucleus. Messenger RNA is very fragile. Maybe we should think mission impossible, but have the injection. The message goes in, your cells read that message, which tells it to create that spike protein. And then within 2 days, that messenger RNA, which is fragile, disappears like the mission impossible message. It self-destructs. So since it never gets into your DNA, you don't have to worry about having that third leg or having anything else happen that's harmful. But if you think of it that simple way, then it's easy to see that you're getting something that's going to make your body make the protein, have a reaction, and make the antibodies to protect. The other thing is that because of that, it's safe for most people to use unless you have some allergy that would be, life-threatening for you.
Dr. MacArthur, we do have some questions coming in I want to address, and one of them is for you, obviously, talking about what is your opinion on the vaccine for pregnant patients?
Okay, my opinion on the vaccine for pregnant patient is we have the American College of OBGYN, which has put out a position statement, which is kind of a negative recommendation that says do not withhold it from pregnant people. They haven't gone as far to say give it freely, simply because when they were doing the testing, they wanted to include pregnant people, but the companies did not. So there's not practical experience in the long-term studies, although some people did get pregnant were in the study. So they're following, and as people get vaccinated now, with the Vaccine Safe program, there'll be more information on people who are pregnant. But when you do risk and benefit, it is a very low risk. Most of my patients are people of color. We're going to be the ones who get sick. And if you get COVID during pregnancy as a person of color, your risk is much greater that you're going to end up in the hospital or that you'll have a serious case. If you have a serious case, you'll be on a ventilator. And if you're seriously ill with it, you have a better chance for a preterm delivery. So for the pregnant person, unless you're in the first trimester, it's safe to take the vaccine. First trimester, it's a wait, simply because if you're that person who has a high fever as a side effect of it, in the first trimester, that's not good for the baby. We would tell you to take, lots of Tylenol, which is safe. But if you can avoid the first trimester, avoid the first trimester. Otherwise, any pregnant person who is not sitting at home alone probably should be out there getting their vaccine to decrease, especially if you're a person of color, to decrease the likelihood of having a serious side effect.
Thank you. And so you guys brought up a lot of great points that address many of the questions that are brought up. We also kind of wanted to, well, there is one question I want to address in the chat, and it's basic, but I think it's important to reiterate, to explain why African Americans are at higher risk of getting COVID.
Yeah, I think that being a critical care and pulmonary physician, it comes right under my realm. The thing of it is, with what we see in the ICU is typical of the patients that are severely affected by this virus. Patients that have diabetes, patients that have hypertension, heart disease, that are overweight or obese, and patients with COPD or kidney failure. Any of those diseases that they seem to be, and especially if you have multiple diseases such as that, you seem to have a target on your chest as far as COVID is concerned. It's obvious that to a certain degree, the immunity is just not strong enough to fight back this virus. And those patients usually will have a course that is stormy. A lot of patients, you got to understand, over 500,000, over 500,000 people in the United States alone had died from this disease. And majority of them are African. I'll put it this way, the African American community has been hit the hardest, let me put it that way. So if you have any of these diseases, and especially if you have hypertension, diabetes, heart disease, then you should definitely be first in line to get this vaccine, because the one thing that we know this vaccine does is it saves lives. It prevents you from having a severe attack of, your body as far as the immune system. It prevents you from, we'll put it this way, it just prevents you from dying from the disease. And that's what we keep you alive.
Dr. Beggs, I wanted to sort of throw this out to you. There are many new variants that we're seeing that have popped up all over the country and different parts of the world. Can this vaccine, the vaccines that we have now, prevent, protect us from these variants? Or how can taking the vaccine help when it comes to variants in our community?
Okay, this is a very important question. So as we know, as viruses replicate, they mutate, these mutations go on to form various variants. Now, there are several concerns with COVID-19 management in light of these variants. One of the main concerns and the most worrisome one is the whole question of vaccine escape. That is to say, the variant will evade the immunity induced by the vaccine. Now, as it stands now, based on lab data and based on some real-world data, it seems to suggest there will be a diminution in the antibody activity in the face of this variant, especially the South African variant, referred to as the 1351 variant. It does show that both the Moderna and the Pfizer vaccines did see a diminution of antibody activity in the face of these variants. In the case of the UK variant, the B117, which, by the way, is going to be the most prevalent strain very soon, the news is a little better. The vaccine does have some effect in that instance. Now, what the J&J trial showed us in South Africa is that even if there's a diminution in the antibodies, the vaccine will still protect and still give you a level of protection in terms of severe disease and death. So I will say, yes, go ahead and take the vaccine. The vaccine is designed to work polyclonally at various aspects of the spike protein. So if one or two sites are mutated, it could still probably work, as well as you can get some T-cell induced immunity as well, which can help protect against these variants. And in addition to that, the companies, both Pfizer and Moderna, are working on creating possibly a booster or another shot that's aimed specifically for these variants. So we should know soon what's the score on that. Additionally, the longer you wait to develop control of this virus, the more mutations will occur and the more variants we'll have to deal with. So I would say go ahead and take the vaccine. It's going to protect you against severe disease, even if there's a variant out there. There is work going on to see if we need a booster. And the longer you take to get vaccine, the more variants we're going to have.
And then just to follow up on that, we have a question here from someone on the chat about recommending the J&J vaccine, even though it's been reported that, you know, they're effective. It's not at the 95% like the Pfizer. Or Dr. Perrott, you can definitely jump in as well. Oh, I think you're on mute. Dr. Beggs or Dr. Perrott, you can jump in on that question.
So the J&J vaccine uses a different mechanism as opposed to the Moderna and the Pfizer. And two, the trials were done in different stages of the development of the pandemic. So at the point in time in which the Pfizer and the Moderna was trialed, there were very few variants as compared to now. In addition, the J&J was trialed internationally. It was trialed in South America, it was trialed in South Africa. So the data that's presented is difficult to compare because they were tried in different areas, so to speak, and the different mechanisms. But the bottom line is that they both give you 100% protection against hospitalization, severe disease, and death. So I will say if you think that you need a different, some people want a different type of vaccine that has a different mechanism. They don't want an mRNA vaccine, fine. Some people have a phobia for needles. They want a one shot, fine. In the US, the trials showed that it was 75% effective. So I would say get any vaccine that's available to you, and they were tried at different times and they use a different mechanism. So it's unfair to compare them. They're still going to protect you against severe disease and death.
Yes, I'll just piggyback on that statement. It's just that, you know, we have a unique opportunity now because of, again, access is a big, huge issue. There are people that do not have access to this vaccine, and there may be people for multiple reasons, maybe it'll get the first vaccine, maybe potentially miss their second vaccine and not fully immunized or protected. And we have a unique opportunity at some of our institutions that you can get this single one-dose vaccine. And this may be your opportunity because, again, getting people immunized sooner rather than later is better for everyone, especially in our community. And that's just the bottom line truth. The sooner you can get it, the better off everyone in the community will be, and better off you will be as an individual, because this access issue that we talked about earlier is a real issue. And if you have access to getting this vaccine, you should probably get it sooner rather than later. Again, just to echo the same words, it's like this was studied differently. The percentage of effectivity may be a little bit less compared to, but your ability to not have severe disease is significantly impacted by getting this vaccine. It's our best shot that we've got. So please, we want to make sure that everybody is encouraged, and when you can get it, if your opportunity presents itself, please take full advantage. It's that important.
So I spoke with probably, I think, all of you before today, and I wanted to make sure I got this in there. I know many of you have had to convince your own family members of getting the vaccine. Dr. Williams, you had an interesting story I think you wanted to share about getting folks excited about getting vaccinated against COVID.
Sure. This is a situation where this panel has made it very clear the scientific reasons why we should be doing this, and for the sake of everyone's health, for society's health. This is a situation where we have to put our money where our mouth is. So I actually have a picture here. I posted it on social media, specifically of me getting the vaccine, posted it, and then a few people, including my own family members, were kind of surprised. And I actually had a chance to talk to one of my family members saying, "Oh, you already got it? Really? I figured we should wait," which is not something that I was surprised about, because the idea was this was so new and we didn't know exactly what we were dealing with. And my point is, if you have the option between doing something and doing nothing for your health, usually it's a good choice to do something. And I know that so far a few things have been hinted at in terms of the history within the African American community and how we've been treated in terms of healthcare. And I figured, it's one thing to discuss this with patients. It's another thing to provide some of the background information. And it's another thing to say, you know what, this is what I'm actually doing for myself, because I think this is the proper choice for my health, for my family's health, for my neighbor's health, for everyone's health. So that was something that I'm actually a very reserved, shy kind of guy, which is why I had no problem with the rest of the panel talking. But the fact that, posting something on social media, may have actually had an influence enough that, people in my own family were more interested and looking to do the right thing. I just wanted to make sure I got a chance to say that.
Thank you. I also wanted there's just really good questions in the chat here. Can you get the vaccine if you've already had COVID? Should you get it if you've already had COVID? I know that's something you've probably all heard. And the answer is?
Absolutely.
And we're almost running on time here. We're almost wrapping up. I'd like to talk about access. Dr. MacArthur, I know your story that you told me with a family member had a lot to do with access and getting, a lot of people aren't able to make their appointments. And can we talk a little bit about what to do if you find that you don't have a primary care physician to ask questions? Joining a webinar like this is a good idea, but what are some other ways that we can help people with access to the vaccine?
I think that what you can do is, my situation in my family was I had an older family member who just considers herself a dinosaur and was not going to fight with the computer, and felt in her community there wasn't much COVID, so she didn't get out much. She wasn't trying to do that. And basically, as the mutants became more known, then all of a sudden she starts saying, well, maybe this is something I need to do. But at the same time, I think whenever you can, if you have kids who are computer savvy, or if you have that ability, then I think you reach out to other people. For her, it was me running around seeing what was happening in New York and getting her on a site where, when they announced that they were putting more vaccines at pharmacies for seniors, because I had registered and was following up with where things were, I could tell her on February 14th, they're opening up as of the 15th. And she thought, okay, I'll get on later in the day. And I said, no, this is Friday night, the 13th or whatever. You're going to stay up till 12 o'clock. And at 12:01, you go on. And at 12:20, she had an appointment just like that. But I think it's making people aware of where the sites are and the times of day. A lot of times, first thing in the morning, 8 o'clock, you may be able to be on the same site that you couldn't get through, and you'll see there are 100 vaccines at Kmart. There are, so many at Essex County College. And by doing that, when you see that, call your friends who you know who haven't gotten it and reach out to people who you know are looking so they can hop on and then sign up. But I think we have to make the effort as a community to help each other. And that means most kids are pretty smart with computers. Use your kids. That's what they're there for, to help you. And make sure that you reach out to as many older people as you know that, won't be able to do it for themselves.
Yes, Dr. Ford. You're muted.
Okay, can you hear me?
Okay, go ahead.
So this has been a very aggressive disease, and I think we need to attack this very aggressively. There are several things that I would do. I would drop the vaccination requirements in those areas that have lower vaccination rates. In other words, if you have a 7% vaccination rate, and you know via your zip code that the incidence of COVID-19 is very high, you have people within the same household who want to get it and some who don't. You can get the herd immunity quicker if the people that want to get it but just don't meet the requirements. They may be 19 or 20 years old, or they may be waiting for another one of the many reasons that are stipulated for people that can get it and can't get it. I think you have to drop that in the areas that have very low vaccination rates, and let everyone over the age of 18 who wants to get it, get it. That's going to get you the herd immunity quicker. The other thing I would do is I would make sure, now there's been an issue about people coming into the community who aren't supposed to get it once you should get it. What I would do is I would target, I would make people use driver's licenses and utility bills to make sure that they are from the community. So when you drop that requirement and use driver's license and utility bills, you're almost targeting that very same community specifically. Again, I mentioned the pharmacy deserts, trying to make sure that pharmacies are getting the vaccination, but if you don't have a pharmacy in your neighborhood, it's no good to you, because if you have to take 4 buses to get there, it doesn't make any sense. The last thing is they mentioned something about how do we contact people? Well, listen, every cable company in the state of New Jersey has a free site for everyone. Information should be flowing across that medium because it's free, it's already paid for, and it's part of letting the cable company into the community. So we should be pushing our state legislators to make that available so that the people who don't have computers can get their information from that medium. Everybody has a TV.
Yeah, and I think this is so important. And I'm not on mute anymore. You hear me, right?
Yes.
The thing of it is that I know in Essex County we have federally qualified health centers, and there's Newark Community Health Center that's giving the vaccine out at this particular point. You can call them. Your local hospital is always a source. If you have any questions on where to get it, or your local hospital may be giving the vaccine, so give them a call. Your health department, your city health department should be able to guide you where to, and locally, that you can get the vaccine. And just like my secretary here, she called City Hall. City Hall actually arranged her to get her COVID vaccine shot. So these are some of the things that seniors can do. They may not be able to handle the computer, but guess what? They can make a phone call to City Hall or the health department or the local clinic or the hospital. Very important.
This is great. This is great information.
Take the vaccine out.
We can hear you now. Go ahead.
Yeah, I think we should take the vaccine out to, like someone said, the zip codes that are most highly affected. Utilize the 1-dose J&J vaccine in these areas where, it'd be hard to get follow-up with these people. Like Dr. Bay said, utilize the community health centers, the emergency rooms. We could do that. We could also have mobile vans that go out to these communities. Why we have to make it so difficult for people to register? People who have a computer, how are they going to register? So we have to break down the barriers. The policy makers can't just say people, are hesitant. hesitancy has been there for years, since smallpox. We have to make the registration and the access and the availability, and to instill confidence in people the vaccine is safe and reliable and effective, so they go out and take it.
Thank you. Well, I think you guys.
The other thing I would say is making people more aware of who qualifies even right now. In New Jersey, if your BMI is 30, that's considered obese. You take your height and you take your weight. You can look up a BMI calculator. Anybody between the ages of 18 and 64 right now, today, can go get their vaccine if they have a BMI of 30. And it's not hard to have a BMI of 30. So if you do nothing else tonight, go on your phone or your computer, put in BMI calculator, put in your height, put in your weight. If you see that you were 30, call up and get yourself in there to get done.
Right, 30 or above.
Yeah, 30 or above. Yeah, but lots of people are 30, so go get your vaccine.
So this is all great information. I think you guys have done an excellent job this evening. Thank you so much. I want to get final thoughts from you, and also because we did get several questions and we're getting them on the chat as well. We know we don't have any pediatricians on, but we all, dealing with families and taking care of families and people who have families and children. How do we keep our final thoughts on this vaccine and keeping our children safe from the spread of coronavirus, because we know that children, we're not part of the studies, and this vaccine is not approved for children at this point. So how do we keep them safe?
Yeah. It's interesting. I'm not a pediatrician either, but what works? Facial coverings work, distance works, and washing your hands and sanitizing the areas that the children are playing. It works. At this particular point, the virus is out there, and the vaccine is not approved for the children. But we must be cognizant that our children can catch the virus as well. Also, adults getting the vaccine helps protect your children. So let's get this vaccine. Let's not hesitate. Dial up today. Let's get an appointment. Get the vaccine.
Perfect. Dr. Parad, final thought?
I would agree with all that's been said previously. It's important that we all get vaccinated, and the Black community is not getting vaccinated, but the white community is pushing people out of the way to get vaccinated. So it's really important that they use all their resources. So we need to also make sure that we're using all of our resources to keep our patients and our family members and our community members safe. I can only speak from the emergency department perspective, and this was traumatic for me. So when I speak to my family, I just have to let them know about my experience and my day-to-day going to work in the midst and heights of COVID. So that reality in of itself is sobering. And, if that doesn't convince people that you need to do what's right for you, it's going to be very hard to convince you otherwise. But I think, the treatments have come and gone and they've changed, but this is a real shot at us getting better and doing better as a community. So I think we should take full advantage of it.
Dr. Beth, do you have a final thought for us?
Yeah, well, this is a time of great hope. The vaccine offers us great hope, but it's not a panacea. And I think somebody asked a while ago if it's going to be cured. It may not be cured, but at least we can try to bring it to the level of which it is a common cold. You get infected, but you don't have to die. You don't have to get intubated. You don't have to go to the hospital. You get like a mild common cold, as typical of the other coronaviruses. So I think the onus is on us at this point to go out and instill confidence in the patients that the vaccine is safe, it's effective. We should call upon also church leaders, community leaders, people of influence in the community who can speak to patients and encourage them, and to avoid the mixed messages, especially out of the internet that someone spoke about before. Avoid the mixed messages that will instill doubt in these patients, and just lead by example. Tell them you've taken it, you've got good results with it, you recommend it to the family. And this is a time where it's almost a civic duty for everybody to take the vaccine and try to challenge this pandemic together.
Thank you. Dr. Williams, any final thoughts for us? Keeping
Sure.
ourselves during this time?
So just to go back a little bit, because I know we kind of introduced this at the start, and I'll admit I'm on the younger side, so I know the story, but some people may not. When the Tuskegee situation is mentioned, it's been misconstrued, and I've had a lot of patients actually tell me a wrong version of it. Their thought was somehow the government had injected people with syphilis and it caused all these problems, so you have to avoid any interactions with healthcare. The actual situation, which still was unethical, was that people had syphilis and it was a longitudinal study. So the thing that we've been fighting for the past several decades, and why we have internal review boards, why we have informed consent, and all of those things, is to have the right to have proper treatment and access. So ironically, some of the things that have been misinformation for a long time for a lot of people may be one of the reasons why, along with the political climate, not to name names or anything, that may have led to a lot of the hesitancy that we've seen with African Americans. So just the idea that we now have an opportunity, something that has been proven, something that is safe, something that, you know, may make our lives better for the long haul, I am totally in support of it. And I just want to make sure that we all spread this message as loud and as you know, as effective as possible. And if panels like this are the way to do it, that's great. You know, grassroots, just talking patient to patient, that's great. Talking to our own families and knowing that, you know, we've read the research, we have the education, and we're willing to let people know that you don't have to have fear. The biggest thing that I saw as a mental health provider is the anxiety and the depression of the idea that things were out of our control. This is our opportunity to take it back.
Thank you. Dr. MacArthur, you have a final thoughts for us?
My final thought would be, think about where you want to be a year from now and what you want your life to be like a year from now. Do it for yourself, do it for your family, do it for your community. And if enough of us, Black and people of color, don't do it, it won't be of anybody's benefit for the whole United States. So do it for everybody so that we can get back to a more normal life.
Very nice. Dr. Ford, I'll let you have the final word here. You have to take off mute though.
There we go.
Okay.
Thank you very much. I'd like to thank the organizers of this event. I think it was very fruitful and helpful. I would say that for the audience who are listening and the audience who are viewing us, the people in front of you have your very best interests in mind. We have families, and we're telling our families the same things that we are telling you. And if you come to us, if you speak to us, we will tell you, we will be transparent with you, we will be open and honest with you. And I think that by doing those things, you can get a clearer understanding. Look, we're very smart people. We understand, but we just need to explain it to folks. And once the explanations are there, people make the right choices. The trust act issues, the fear issues, the access issues, we get it. We understand. We're in this thing together, and hopefully by this time next year, we can go ahead and live our lives where we previously lived them. And I just hope and pray that more people get this vaccine so that we can knock this thing down. Thank you.
Thank you. Thank you all. And thank you all for joining us. It was a very lively discussion from our panelists and from our everyone on the chat here who joined us this evening. So we really appreciate that. Really appreciate your engagement. We have some links for you where you can find out information on how to register for the vaccine at an RWJBarnabas Health facility. And you can also go to the New Jersey COVID-19.nj.gov page to get more information about vaccination in New Jersey as a whole in the entire state, or visit one of the websites in your local county. We have for you the Essex County, EssexCovid.org, Hudson County, HudsonCovidVax.org, VAX, or in Union County, you can go to UCNJVaccine.org to get more information about the vaccine in your area and to find out where you can register. So thank you. Thank you very much.